Welcome back to What's Next? Living Longer, Better, Smarter. Thanks for tuning in. In this edition, lessons to learn for healthy aging. First, this message. This episode is made possible by Silicon Valley health tech innovator Vital eCare, providing a digital platform that improves the way clinicians, patients, and their extended care team collaborate on the daily needs and care plans for people experiencing chronic diseases, age-related conditions, and multiple elements of health-at-home orchestration. Vital eCare's unique toolset helps patients better manage their health outcomes by automating the collection and reporting of critical data not captured in their health records, such as diet, rest, exercise, emotional wellness, medication compliance, and specialized activities, and then giving their doctors visibility to that data for improved holistic clinical management. For more information, visit vitalecare.com. I'm Fred Fishkin, along with Mary Furlong. Hi, Mary.
Hi, Fred. And here we are at the end of summer already. I can't believe it. And children are back in school. Where did it go? And it's a great time for us to focus once again on health. And we have amazing guests with us today.
We do. First up, we have the Director of Global Aging for AARP, Vijeth Iyengar. Hi, Vijeth.
Hi, Mary. Hi, Fred. It's great to be here with you both.
Vijeth, thank you for spending time with us this morning. Let's start with a little bit of an overview of your background and the work you do as Director of Global Aging. So impressive.
Well, I appreciate it. My entry point to the field of healthy aging and longevity was through research. I'm a cognitive neuroscientist by training, and what that means was that I was very much interested in how our brain helps us function in society. And I was in a lab at Duke University from 2010 to 2016, looking at how our brains support our ability to remember. And we studied this memory process in both younger adults and older adults. But Mary and Fred, about 4 years into my PhD, I realized my real passion was at this intersection of science and policy. So how do we translate what we are learning in the lab to society? And so I made a slight career pivot. I was toiling around with a startup in India, looking at peer-to-peer caregiver support. It was called Head Matters. I was sort of dabbling in that. I was either going to be a management consultant or go into government. And fortunately, I was able to get a 2-year fellowship, the Presidential Management Fellowship, to go into the U.S. federal government. And from 2016 to 2021, was really fortunate to have a variety of positions in the federal government, from the Administration for Community Living, first as a program officer, managing multi-million-dollar programs for supportive service caregivers of folks with Alzheimer's disease and related dementias. And then as a technical advisor to the former Deputy Assistant Secretary, Edwin Walker. I also had the great fortune of scratching a global health interest itch I've had for many years, and spent about 6 months at the Pan American Health Organization here in Washington, which is the WHO's regional office for the Americas, looking at dementia incidence and prevalence in Latin America. And then sort of rounded out that experience spending about 1 year at the White House Office of Science and Technology Policy, serving as a policy advisor to the 4th CTO, where in 2020 we did a lot of tremendous things, including standing up a mental health innovation challenge that brought together different federal agencies. We created a new older adults data sort of cluster or collection on data.gov. And we put out a new RFI on looking at emerging technologies to support underserved populations. Though it was a real treasure trove of experiences across those 5 years, across the Obama, Trump, and Biden administrations. But then many mentors at the time told me I need to get different sectoral experiences. And so I was fortunate enough to join AARP in January of 2022 on the international team as Director of Global Aging. And, to get to your question, what I envisioned this role is that we really sit at the nexus of research, research-informed policy, and then stakeholder engagement. And so those are the three verticals. We see global aging as truly that third pillar behind gender and climate that should get attention from different stakeholders across the community, whether it be the VC community, government, public sector, or private sector. And so across those three verticals, we try to produce original research and thought leadership that drives some issues that are pertinent to global aging, whether it be the human rights of older persons or innovations and best practices abroad that the US should be adopting. On the stakeholder engagement piece, we see, again, global aging as a global megatrend, as an issue that will be of the 21st century and beyond. We try to engage different stakeholders and widen the tent in the community of stakeholders that care about aging. And so we have this global thought leadership conference that AARP produces. We also host a slew of salon dinners and small get-togethers and convenings with key stakeholders to drive home the point of the both economic value and the business case for healthy longevity and aging, to both to ranging from that to human rights. And then lastly, we see ourselves as sort of policy advocates or policy champions. And if there is a good bit of policy or research that we've uncovered or unearthed, it's sort of in our remit to be able to then share it with key stakeholders here in the US. And so this nexus of research, policy, stakeholder engagement really drives our day-to-day interactions and work. But the real goal is to then elevate this issue of global aging around the world in countries where they might not be experiencing the aging demographics yet, but there could be opportunities in the next 2 decades or so to realize those gains.
Yes, one of the things you've done is take a look at the interest people have in this country in healthy aging practices outside of the US. So tell us about that.
Yeah, it's probably no surprise to your audience, right, that of AARP's domestic work, well cataloged over 65 years. But what's interesting and what's probably less known is our international work. And so since our founding in 1958, we've been engaged globally. Certainly we have partnerships with the United Nations. We have a partnership that we're trying to cultivate with the World Health Organization. We have this long-standing partnership with the World Economic Forum. And so we're engaged globally because we truly believe good ideas have no borders, and that what goes on in, say, Bangalore, India, affects my hometown in Baton Rouge, Louisiana, right? And we can learn from each other. When I first came here, I knew a little bit about the international work, not so much. I was probably like the vast majority of your audience that knew a lot of the domestic work. And so I came in with a sort of an interesting question as to, do older adults in the country, in the US, actually care about what's going on abroad? And part of that was motivated by a lot of these polls, either from Gallup or Pew or Rasmussen, that looks at the US citizens in terms of their American sentiment towards foreign aid. And so you get all these questions about what percentage of the US budget is for foreign aid. And there's always this mismatch between perception and reality. And so I wanted to do a similar type of survey where we assessed American attitudes towards the US healthcare system, beliefs on whether the US or where the US stacks up with other countries, and what level of interest that older adults in the US had about solutions from around the world in terms of achieving healthy aging, and if they thought they could learn from other countries. And so I worked with our colleagues at AARP Research, and I just want to give them a shout out in terms of designing the survey, developing the survey. And so we fielded in 2022, I believe, in the fall of 2022, a nationally representative survey of about 1,000 older adults, age 50 and above, in the US. And we had those questions, right? Level of interest about learning about other countries, what they thought about the US healthcare system, and the beliefs they had in terms of how the US stacked up against other countries when it comes to the healthcare system. And it was super shocking, right? I had these results checked twice, thrice, because going in, I thought interest would be low, to be fully candid with you. But what we found was a staggering vast majority of respondents, 82% of survey respondents, responded that the US could either learn a lot or some from other countries around the world, regardless of development status, regardless if it was a super well-developed country or not. And that 74% of those that responded marked either being interested or moderately interested in learning about the healthy aging practices from around other countries. So what does this mean? This means there's a strong appetite, there's a strong belief among these survey respondents, again, nationally representative across different socio-demographic variables, that there's a strong interest and belief that the US could learn a thing or two. But where does that interest and belief lie from? Where does it stem from? And so we also assessed respondent attitudes towards the US healthcare system, and we found that the US healthcare system was rated low when it came to accessibility and affordability. So 39% rated the US healthcare system as accessible, 36% rated the healthcare system as good, 16% rated it as affordable. So these stats might not be so new or surprising to the audience, but it reaffirms this belief that the US could be doing a lot better. There are areas in terms of accessibility, equity, where it can be doing better, and it could learn a thing or two from other countries.
Really interesting, Vijeth. And I'm wondering if it's a matter of, okay, we can do better when it comes to providing medical care, or are these older adults more concerned, we older adults, I should say, more concerned with attitudes? Maybe the feeling that in other countries, the older citizens are treated better by family, by government, by corporations, et cetera.
Yeah, I mean, I think there are different ways you can slice and dice and interpret the data. I think one thing is the US does rate well when it comes to quality of care, and there's high quality, but access to that high quality care is quite low. And we did notice in the survey, and I didn't mention it in the slew of stats that I shared, that folks thought it was an inequitable US healthcare system, right? And so there are definitely areas for improvement. Of course, these stats might change and do change if you look at the crosstabs. But if you look at the high level, what's clear is that there are some weaknesses or perceived weaknesses in the US healthcare system that we as a global community, if we think about creating a system that's just, fair, equitable, accessible, affordable, across different racial, ethnic, minority populations, that there is room for improvement and that we can learn from other countries.
You've done a report on health equities in low and middle income countries, right?
Yeah, we have. We have a firm belief that the future of aging is in low and middle income countries in the global South. Now, why is that the case? As part of our Aging Readiness and Competitiveness Initiative, in partnership with the Economist Impact, we released a report in February of last year looking at the forces that are driving inequities in healthy aging in low and middle income countries. And we focused on these low and middle income countries because approximately 4 out of 5, or 80% of adults age 65 and over, will be residing in these countries in 2050.
Wow.
Now, Mary and Fred, that 2050 sounds like a long time, but that's 25 years from now. That's a little over a little close to 2.5 decades. And so there is this window, there's this real policy window and opportunity where we can go in as AARP, as stewards of aging, the global community of folks that care about aging. We can go into these countries and make a persuasive argument to leaders, to decision makers, to policymakers, that it's incumbent upon them, as their societies age in the 2 decades or so, that they need to really look at how societies are shaped, how cities, communities, and their economies or countries can help harness the economic and societal contributions of aging populations. And so that's why we focused on this geographical region, because that's where the majority of older adults in the 2 decades or so will reside. The focus on equity really dovetails nicely with the survey findings showing that the US healthcare system is inequitable, right? And it doesn't have accessibility to all. And we saw that there's a real opportunity for health equity because this is not just a global south or developing country issue area. This is a shared global learning opportunity. We can learn from each other when it comes to addressing inequities or disparities in the healthcare system or society.
I like the way you framed this, where you say climate is a global issue. Well, healthy aging, longevity is also a global issue. What are some of these countries that you're just thinking of?
Yeah, no, I just want to pick up on that point, Mary, because I think you hit the nail on the head. Climate, if you think about climate, a couple of decades ago was purely an environmental issue, and then it became a renewables innovation issue, and now it's hitting every sector of the economy. And regardless if you're a venture capitalist in the Bay Area or a government official in DC or in a country capital, what you're seeing is that everyone sees how climate or environmental changes has a role or has an impact in terms of doing business or functioning society. And we really see that aging has a similar role or will play a similar role. There will be demographic impacts. The great work that you're leading looks at the investment opportunities. There are going to be impacts on economies in terms of societies and how they function. And so we really see aging as a global issue. Certainly, there are countries that have unique innovations, right? But I actually want to take a step back. And what we're seeing from other countries that we don't see in the US are these existence of national roadmaps, strategies for aging. At the country level, what we readily see around the world and what's glaringly absent from the US is that many countries have national action plans or strategies, which are these multi-year blueprints that aimed at planning for aging populations and improving the health and well-being of older persons. These action plans on aging, otherwise known as some strategies, they ensure that there are services and supports accompanying budgets and that aging is a priority across government, right, across the economy. And it's front in mind in terms of policymakers. In the US, we don't have that, right? What's clear? In 2022, we developed a new tool for policymakers called the AARP Database of Action Plans on Aging, otherwise known as DAPA. And it sought to compile all these national and subnational plans on aging to understand the different approaches to healthy aging more deeply and to advance more comprehensive, inclusive, whole of government approaches to aging. The database has 50 plans at the moment. And what's, again, glaringly obvious is that the US is not in that database. The majority of progress made towards these action plans on aging is at the state levels in the US. California has its master plan on aging. New York has a multi-sector plan on aging. And we're seeing this great movement around the country at the state level around these action plans on aging, right? But there's been some positive signals. In May of 2024, the Administration for Community Living, as part of the Interagency Coordinating Committee, released their strategic framework for National Plan on Aging for the US. It was a report to Congress. And I see you holding it up there, Mary. And it was a first step towards what a US national plan could look like. And in July, AARP released its own vision for a national plan that's largely complementary of the strategic framework from ACL. And so while I can go into specific countries in terms of innovations or initiatives being planned, what is clear to us is that the US is lagging behind other countries at the national level when it comes to these national level blueprints and these action plans to support older adults. But we're really gratified at the steps taken in the past couple of months after years of work and advocacy and championing of these efforts, that there's a real movement that really started out at the state level to then bring to fore what a U.S. national plan could look like. And that is important because it's not your typical technology-enabled innovation, but it will spur a lot of innovation, growth, and aging as a national priority action area.
Some people may be a little bit confused in trying to figure out what it is exactly we're talking about with an action plan. There are some who might say, hey, we have Medicare, we've got Social Security, that's our plan.
Yeah. 100%, yes. But I think, it's about mainstreaming aging. It's about aging is not just a siloed issue, but these action plans have the benefit of ensuring that every level of government or every agency within a government, whether it be state, federal, local, has an investment, has sort of an equity into aging, whether it be housing, transportation, the design, urban planning, and that with given that they have equities in this issue area of aging, there's an accompanying budget and accompanying priority. So it sort of makes sure that aging, every agency touches on aging. It's a very similar game plan for climate. Now every agency has some sort of investment into the issue area of climate. They're coming at it from different angles, but the goal is that if every part of the government or every sector has some sort of equity into an issue area, then as a whole, we could bring about positive, effective change. The key area, Fred, into these action plans is that they're not siloed into any one particular area of aging. It's really a catalyst to bring together partners from different sectors of the economy to come together with a common goal, in this case, to boost health and well-being of older adults.
I really understand the way you've shared that. That's a really important point. Years ago, when I was in the forefront of the ed tech movement, when it went into schools and to senior centers, I was really early on in that movement. And other countries were having frameworks for incorporating digital education into schools, and you could pick up the framework. But I see the same thing kind of happening again with healthy longevity. And I think that's the best way to frame the concept, because we see it here from an investor and entrepreneur perspective. And every time I do a conference, I say, here's the ecosystem chart. Well, the ecosystem chart just keeps growing and growing. And you can't look at housing and older adults without thinking about healthy longevity, because there's a large number that are unhoused. So you have to have policy in all categories, I think.
Yeah, no, that's true. Look, again, Mary, it's unsurprising you hit the nail on the head. There's a real shift in discourse, and we're seeing a paradigm shift away from just focusing on aging or longevity to healthy longevity. And it's that qualifier that really makes sense. The global community is shifting away from exclusively focusing on life expectancy. Of course, life expectancy gets all the headlines in the New York Times, declines in life expectancy. But I think the real special bit to look at is fostering ecosystems, healthcare systems, society, so that we can ensure that we can extend or boost, rather, the number of disease-free, healthy years, disease-free, injury-free, healthy years that individuals can live, right? And it's this health span that's important. Lifespan is important, but health span is a little bit more important, a little bit more nuanced. I'll tell you just one real data point is women, of course, tend to live longer than men, but they tend to live in more years of poor health than men. So there's a health span disparity between men and women. And so having that additional nuance of focusing on health span allows one to then target policy recommendations, initiatives, programs to then look at closing that health span gap between men and women.
So one of the topics we focused on from time to time is, what does longevity mean, and how it's not enough just to add years to your life if they're not healthy years. So a lot of people are talking about lifespan, healthy lifespan, brain span. How do you think about longevity and healthy longevity?
Yeah, so I think we think about it through health span, right? And thinking about it through health span allows one to get a better understanding of disparities. And so one line of work that we're very passionate about is around gender equity. and addressing gender-based disparities when it comes to caregiving. And we see the, over-feminization of caregiving. Women tend to be more caregivers than men. We see this in health span. Women tend to live longer, but in more years of poor health than men. We see this in the income security gap. We see that women, especially in low and middle income countries, because they're not part of the formal labor workforce, they don't have access to safeguards or to pensions or to legal protections. And so they are living longer, but in more financially precarious times. And so focus on health span also allows a window into the social determinants of health. And we know that you don't just live life and at 60, you start experiencing inequities. The inequities are an accumulation across the life course. And so by focusing on health span, you have a clearer understanding of what are the levers and what are the drivers that are contributing to longer years of poor health that one could then address and focus on. And so it's really gratifying to see that the field is moving away from exclusively focusing on lifespan to health span. I would just say, as another wish list for the community, that what we are seeing is greater attention for the life course. And I just want to, we're super cognizant here on the team to ensure that there are enough research, attention, spotlight on the 16 over population and the 15 over population. And because they have differential unmet needs and services and supports that need to be addressed now. And it's not always about early investments early in life. There has to be a balance in terms of attention and scope as well.
You've created a toolkit to promote healthy aging around the world. Tell us about the toolkit.
Yeah, this has been years in the making. Credit goes to a lot of colleagues that predated my arrival to AARP. We've compiled a set of case studies on healthy aging from around the world. They're organized around areas of the UN Decade of Healthy Aging. So focused on age-friendly environments, combating ageism, integrated care, and long-term care. Two quick examples that are in that toolkit. You were talking about EdTech, Mary, a couple of minutes ago. One is the Silver Tech program from Argentina. It's a public-private partnership between the Inter-American Development Bank and ADOS Global, which is a nonprofit educational institution. But the idea is to promote digital literacy among the 50-plus population in Argentina. The other is more of your plug-and-play standard telehealth type of innovation, but it is a really interesting innovation. It's called Caro Health in Uganda. They provide a variety of health and supportive services to rural communities through solar-powered clinics and offering telehealth consults and access to training and medication. Critically, they've partnered with local community-based organizations, the Rotary Club, other churches, to identify older adults in the community that are hard to reach, but most in need. And they've established a network of 71 clinics in rural villages that have 2,000 or more inhabitants. But those are just a snapshot of the programs. There are other sort of innovations that are country-specific, but fall under these 4 buckets. But these feed into our Aging Readiness and Competitiveness Initiative, which focuses on different economies, on different areas. Last year, or 2 years ago, I should say, we focused on collecting healthcare innovations from telehealth to brain health and dementia to access to care from around the world, both in high-income economies and lower and middle-income countries. But the idea is this toolkit is free for everyone. It's not proprietary, but it's an opportunity for us to be a one-stop shop platform for the global aging community to come in and say, if they want to learn more about research, innovations, how to get more engaged, they can come to our resources at aarpinternational.org to then come and get a better picture of what the opportunity is for global aging, what the business case is for global aging, if they're interested in human rights, what's the case behind that? What are the updates? And to your audience, Mary and Fred, if they're truly invested or interested in innovations and healthcare innovations that are low cost, scalable, replicable, validated, at times with universities here in the US, they can come to that website and learn more, and certainly encourage those folks that want to learn more to engage with us.
Really terrific. Before we let you go, Vijeth, you talked at the outset here about how older Americans think that we need to learn from other countries. Things are going on. If you had to pick one or two things that maybe we should be learning from other countries, what would you point out?
And what we're seeing, and especially in Southeast Asia and Thailand and Vietnam, are strong community-based organizations. And so they have these older persons associations that have proven to be incredibly important for improving health and well-being of older adults. They're proven to be scalable throughout the country. The engagement with community-based organizations and centering any innovations or best practices with the older adult in mind and elevating the older adult, person voice. We see this in many countries. In terms of healthcare innovation, we see that, especially in Africa, Asia Pacific, the use of telehealth in interesting ways. I gave you an example of a telehealth consult access using solar power, right? And especially in rural areas. And so I see there's a great opportunity for innovators in the US to learn about these low cost or no cost innovations that are going on abroad and seeing if they can replicate them here in the States. Because, the sort of silver lining to a lot of these issues, especially when it comes to inequities, is that I imagine that the resource constrained settings that we readily sort of associate and see with lower and middle income countries, you'll also see that here in the US, in rural communities, in frontier communities, resource constraints. And so there's real opportunity to learn from other countries as to how they're managing during resource constrained times, especially from an innovation point of view, and keeping costs low while keeping quality of care high.
I really love this idea. I love this global look. We've been working with the SCAN Foundation, and they've been focused on the forgotten middle and this notion of the globe. I just judged an international competition, so I saw the innovation come in the business plans. It was on dementia. But I think that these, if you think of it as you structured this, to think this is a big theme, a global theme, and then you see innovative solutions with communication today, there's an easy way to share those stories and those use cases. And we want people to read your research. We want people to go in and look at the test kit. So we're so grateful for your team, and congratulations on the work you're doing. It's so important. And thank you for sharing your time with us today. I see this as coming together from your prior history. You've really put something important together.
Well, I appreciate the chance, Mary and Fred, to chat all things global aging. I know it's a bit different for the audience, but hopefully it gave a sampling of the opportunities that abound outside the US. I'd be remiss to say, look, we're not the only players on the block. National academies are doing wonderful things with a global roadmap. NIH, Fogarty International are doing amazing things. I think, as I mentioned, the future is global aging. There's a lot of opportunity there. And I just want to thank you, Mary, specifically. You've been a trailblazer, voicing aging and longevity for decades. And the global aging community would benefit you from investing a little bit more in time into this space, should your schedule allow. But I really appreciated the chance to join.
It's funny you say that. I once won an award, and there were 3 of us that won, and I was early on in my career, but someone was from Africa, and they actually were responsible for feeding a community. And I was so humbled by winning the award. When you saw what other people were doing, where really the rubber meets the road, so the solar powered clinics. But I remember back when Melinda Gates had the initial, how do we bring technology into schools? And they brought people from all over the US together who represented those constituent communities. So I do think with the statistics you shared about the growth of older adults and the needs that they have, it's imperative that we use the telecommunications solutions to share these best practices. It's very exciting work. And I
Yeah,
want to get the investment community more involved in looking at this and investing in this area. I know Seven Wire Ventures is doing that, but a lot of the innovations are relatively inexpensive and can be adopted.
look, I'll just close with 2 points. One is, again, Mary, I think you're on to something. We need to widen the tent of individuals that care about the issue of aging or global aging. That's why we made a concerted effort to involve the development finance institutions, say the World Bank or Inter-American Development Bank, where aging isn't super high on priority. We need to engage philanthropy, where they're focused on gender, they're focused on all these cross-cutting issues, but why not aging? I think we're making some inroads with the private sector community. You've, of course, done amazing work trying to bolster interest within the VC community. And we see that it's paid dividends, right? It's taken years, but there's real value in investing in the time and energy to bring different stakeholders who aren't thinking about aging on a day-to-day basis, but can add different lens, different networks to the fore. And I'll just say, I think this is also a good venture opportunity. I don't know personally of many VCs that are looking at reverse innovation or trying to bring innovations from abroad to the US. I'd be curious to learn more because I do see there's an opportunity to sort of, there's a strong investment thesis to look at innovations abroad that are low cost, no cost, that can scale here in the US, but perhaps for another conversation.
Yeah, Fred, if you just allow me to say one more thing, it reminds me of the story. A woman who didn't get a grant from the World Bank, and she said, well, what's the secondary market if you don't get a grant from the World Bank?
Yeah.
And she said, well, she started a business, a nonprofit, very successful, called Global Giving, and they did microloans globally. And I thought it was such a great question. And I sort of think, what is the secondary market for global investment and diffusion of innovation? And I can think of a few VCs that might be interested in that topic. I'm going to share this with them. We'll send them the podcast.
Yeah, that would be great. I'd love to engage with them, even if it's just to learn about what their investment thesis is, where they see opportunities. We're always on the prowl to learn more about what other people are doing. So thank you again for this opportunity.
Well, thank you, Vijeth. Just terrific work. And that website again for more info is aarpinternational.org. Mary, our next guest, is also focused on health and our prescriptions. Leigh Purvis is Prescription Drug Policy Principal at AARP Public Policy. Sounds like a tongue twister. Hi, Leigh.
Hi, how are you?
Leigh, thank you for taking the time to join us on our podcast this morning. And you have such important information to share on annual out-of-pocket prescription drug costs that will be capped next year for Medicare Part D enrollees. Give us an overview. So important.
Yeah, we really are trying to get the word out about this important new protection. Starting next year in 2025, there will now be a $2,000 cap on out-of-pocket expenses for people in Medicare prescription drug plans, also known as Medicare Part D. This is really important because previously there was no cap on out-of-pocket expenses for people in those plans. And we know that some people were spending upwards of $10,000 per year. So the fact that these costs are now going to be capped at $2,000 is a really big improvement and will result in a lot of savings for a lot of people.
AARP has put together a report analyzing how much money Medicare recipients will be saving.
We did. We tried to get a better idea of exactly who's going to benefit and by how much. And what we found is that next year, there are going to be about 3 million people who are going to benefit from that cap. And that number is actually going to grow to more than 4 million by 2029. And over that same time frame, about 40% of people who hit the cap will see savings of around $1,000 or more. And some people will see savings of more than $5,000. So we really are expecting some very big savings for people who were struggling with high prescription drug costs.
Will this be a complicated process for people to take advantage of? Can you step us through how it works?
Sure. This should actually be pretty seamless for the people who are going to benefit from it. It's just part of your prescription drug plan. So your plan will be accumulating how much you've spent out of pocket. And once you reach $2,000, you will not have to spend any more for the rest of the year.
And are there some disease states that are going to be carried, well, this will affect more than others?
I would say any condition that requires expensive drugs, and things like cancer or multiple sclerosis are very good examples. They will in particular benefit from this because we know that they've been spending a lot on their prescription drugs. But the reality is people in Medicare take a lot of prescription drugs generally. You can have a lot of chronic conditions and you take a lot of drugs for them. So it really is something that will benefit anyone who has high costs, whether it's because they're on a high price drug or because they just happen to take a lot of prescription drugs.
And we should point out, I think, Leigh, that this affects individuals, of course, but beyond that, it affects whole families, maybe even beyond those living under one roof.
It absolutely does. We know about a lot of people who were unfortunately having to make decisions between paying for their prescription drugs or paying for other important things like their food or their rent. And sometimes family steps in to help with those costs. But other times you hear about people who choose not to fill their prescriptions at all. They're not taking their prescription drugs as prescribed because of the cost. And that unfortunately can have some pretty severe health consequences down the road. So the idea that these costs are now going to be capped and people will not have to spend as much is important for really everyone and their loved ones. It's a really important protection.
And we know AARP has been fighting this battle for a long time. So can you tell us how it came together?
Yeah, so the new out-of-pocket cap is actually part of a lot of different changes that are due to a law that passed in 2022 that is really trying to address high prescription prices and costs. So the out-of-pocket cap is one part of it, but there are also things like allowing Medicare to negotiate prescription drug prices, which is something that AARP has been advocating for a very long time. And that is going to help people a lot with their costs as well. But there are a lot of other provisions in there. So things like capping copays for insulin at $35 per month, or making sure the recommended vaccines are free, or penalizing drug companies that increase their prices faster than inflation. So there is a lot within that law that will go a long way towards creating savings for Medicare and its beneficiaries, and it is definitely something that AARP has strongly supported along the way.
And it's always a battle in Washington to get things like this through. So congratulations on the work that you and AARP have done here. Where can people go for more info?
People who want to learn more about the out-of-pocket cap can go to aarp.org/Part D spending cap.
Well, Leigh, thank you for spending time with us this morning and for this amazing work.
Thank you so much for having me.
The website again is aarp.org/Part D spending cap. We want to thank our sponsor for this episode, Vital eCare, a Silicon Valley health tech innovator, providing a digital platform that improves the way clinicians, patients, and their extended care team collaborate using data from consumer health devices and lifestyles. Find more info at vitalecare.com, and thank all of you for tuning in. Stay healthy, and remember you can always find us at maryfurlong.com/podcasts.